somebody just posted the question in a group and I cannot see them right now. What do you think about okay? I should choose you. I'm interested. So the first question that we will be taking today would be, why should I take you into our program? Like somebody just posted in the group, so we'll take that question first. And
Ayushman, can we write that in the chat box?
sure. Yeah, just go ahead.
Okay, what was the first question?
The first question is, why should we take you into our program? Then the second question is, tell me when you went. Why should we take you into the program? Thank you, Harshita. And the second question is, so the first question that we will be taking today would be, why should I take you into our program? Like somebody just posted in the group, so we'll take that question first. And
Ayushman, can we write that in the chat box?
sure. Yeah, just go ahead.
Okay, what was the first question?
The first question is, why should we take you into our program? Then the second question is, tell me when you went. Why should we take you into the program? Thank you, Harshita. And the second question is, tell me when you went above and beyond to help a patient. When you went above and beyond to help a patient. Yeah, thank you so much. Yeah, so these are the two questions we'll be taking. You can just post another question of your choice. We'll take that. Third question would be that. So yeah, the first question is, why should I take you for our internal medicine program? Just anybody wants to answer this question, because that's a very frequent question that we ask all of us, like whenever we have our interview.
I can try.
Yeah, sure, go ahead, Dr. R. Thank you.
I believe I would be a constructive team player because of my previous experiences, not in the line of medical field, but also from the military side. I have worked with teams and had the opportunity to manage teams. I had been fortunate that I've been trained by different people in different circumstances. And on the other side, I was brought up in a very disciplined way because my father was in military, and that I inherited the same work ethic from him. And now being a mom and living with a physician, that has exposed me how the medical system in the US works, the patient confidentiality, how the EPIC and HIPAA works. And that has equipped me well how the system in the US work. And yeah, I think so. It's very random, but please give me your feedback. Yeah.
So yeah, according to me, like when you said about army, that's a very positive impact, because whenever somebody hears about the army, the first thing that comes to the mind is that the people from army background are usually very disciplined, and everybody needs such people in their program. So according to me, your answer was good. You just need to practice more on this answer. Otherwise, the wording is very, very good.
Thank you.
Anybody else wants to give the answer?
Yeah, I think I would like to try.
Go ahead, thank you so much. Go ahead.
Okay, so thank you so much for asking me this question, and I'm sure you have a lot of great candidates that you have to interview. So I believe that hard work is really important in any field, and I believe my strong work ethic is something I'm very proud of, and that's what I bring to the table. So whenever I'm working somewhere, I make sure I reach there on time, I finish all my deadlines, and before I leave for home, I've met all the important work for that day. For example, during my rotation back in my home country, I would make sure I stay back, even if it was overtime, to ensure all the important work of my patient was done, to just make sure any negligence or any delay from my part does not affect their management. And I think this was something which was noticed and appreciated by my seniors. Another thing I would like to say is that I think I'm a very quick learner and I'm able to adapt very quickly to different environments. And having had the opportunity to rotate with various doctors here in the US, um, I've I've had the opportunity to quickly adapt to different environments. And just recently, I was rotating with Dr. Khan, and she commented how she was greatly impressed by my ability to quickly adapt her methods and quickly and how swiftly I was able to navigate through the EMR, and she really praised me for it. Furthermore, I think with my clinical experiences and with my volunteer experience at the American Red Cross, I can confidently say that I am a good team player. I'm able to work well with different people. And I also have an insight into the US healthcare system, especially I'm familiar with the different EMR systems they use here, like the eClinical Works and Practice Fusion. And I believe all of this would help me seamlessly integrate into your program. And I'm looking forward to make meaningful contributions. Thank you.
Dr. Zaya, that was a good answer, very, very good answer. Well framed and everything was good. Yeah. Anybody else wants to give the answer to this question? Like, why should I take you into our program? Harshita, do you have an answer?
Not prepared, so not think of anything right now. Like once I frame it, I'll let you. Like I can answer it.
Sure, sure. Okay. You just think about that. Yeah, Dr. Sapta, do you have an answer to this question?
Um, okay, let me try. I think
Go
it will
ahead.
be long, but let me try. Okay.
Go ahead. Go ahead.
Thank you for asking these most valuable questions for the program. I would like to highlight 5 to 6 aspects by answering this question, in which areas I believe I can be a contributory uh, applicant. Um, First point is I believe that medicine protocols and the approach to the patient care are moreover similar in US and India, because we are also like following throughout our medical school and during my working in pediatric, all the international reference book like Harrison, Nelson's, Robbins. Also what I've observed during my clinical rotation in United States. So definitely I would like to contribute my clinical and working experience for better patient care in both the especially in pediatric. The another point I want to talk that I have got the privilege of working and managing pediatric cases in one of the most diverse and like overpopulated country like India. So I want to use that experience and exposure and also clinical skill of seeing various diverse cases, rare cases, critical cases, which will be definitely contributory to handle the critical patient in the US for your program. The third point I want to talk about adaptability, that there are times when I have worked in resource limited setup during during the posting in during the posting in unserved areas, and also like emergency like epidemics like dengue and pandemic like COVID. So and also the places where I have worked, mostly the workload and the patient load over the doctors are very high. So that resiliency, that resilience and that adaptability and the efficiency in terms of like working in a high pressure areas will be definitely helpful to handle the like adverse any kind of adverse situation even in the US healthcare. And also like beyond medicine, I want to talk about my leadership. Like I have played multiple leadership roles in my career. I'm someone who loves to take responsibility. I've organized multiple cultural meet, mortality meet, academics, and also like leading the COVID emergency task force during the pandemic. So I want to contribute in that area. Also, I have used my creativity skills in making posters, flyers, even attending multiple webinars as a panel member, like to address the vaccine hesitancy and all. So I think that way the program will be beneficial from my creativity skill. And when I read about your program, I got to know that your program is focusing a lot of service to community. And I have experience of working in multiple community outreach projects during my PSM posting, like door-to-door survey, house visits, also like conducting health camps and doing the vaccine camps and all. So that way I feel like I'm passionate for community service. And I can contribute. The another thing I can talk, like everyone who is connected to me, they describe that I'm very good in communication and public speaking skill. So being a social and empathetic person, I connected to people, children, their family very easily. So I believe definitely I'd be contributory in handling the cranky and critical pediatric patients. The last point I want to talk in a lighter note, that residency life can be very stressful sometimes, can be hectic. So definitely as a creative person, I would like to entertain my teammates as a good team player, in terms of like poems, stories, and also in terms of dancing, music, because I am a classical dancer. So at least I can make the environment little bit more lively, and also like I can bring simply smile on the teammates when especially they are very overstressed. So that way I feel like I can be a contributory as a good candidate, good fit for your program.
Perfect. So yeah, Dr. Sapta, I just have a feedback for you. Like I have been interacting with you for so many days. Like I have been listening to you. So you are very inspiring. Firstly, you have a lot of things to share. But the thing is, you really need to work on your answers. Like you cannot speak this much. Like I lost interest in your answer. It was too long. Though it had mentioned a lot of your qualities,
Yeah,
right?
that I'm going to tell. Like I have like highlighted 5-7 points, but when I'll get an interview, I feel like I'll just go to their website to see the goals and missions. That
Mhm.
way I will just tailor the point, like whatever the program is needing, that way I'll talk about 3-4 points that I feel.
Otherwise, your content is very good. You just need to work on your length of your answers. You are
Yeah.
multi-talented. Like you as far as I can make out from your answers, every time I listen to you, you are very multi-talented.
Oh,
Fine,
thank you.
really well. But the thing is, you need to work on your answers.
Yes,
Like the length
thank
of your answers, that's it. Yeah.
you. Okay, thank you.
We do have Dr. Suraj and Dr. Om with us as well. Dr. Suraj, do you want to answer this question?
Hi, Dr. Gupta, how are you?
I'm good.
So
Okay.
I would say, I mean, I'm just writing still my answers. So the whole thing, the whole suggestion for everyone would be that, as Dr. Sapta said, you have to go through the programs, aims, and missions, and according to that, you have to make your answer. And it's not necessary that for every program you will be giving the same answer, that why they should choose you, they should choose you. So when you read the aims and missions, so of course, ultimately they would be the same things which you have already written in your answers. Only the wording would be different. So I would advise everyone to go to the get those words from aims and missions, and then write your template for your every program, and then 2 3 days before, when you're interviewing at the specific program, go through their website and try to change those wordings.
Mhm.
If I would be the person who would be answering that, so I would say that's a very great question. I understand that choosing a great candidate, how important it is for the program to have a candidate who can spend 3 years in the program, and who can spend 3 years in the program, and they feel like a family with them. I would say my three greatest qualities that I have, which can benefit the program, they would be my adaptability, flexibility, and resilience that I got from my 15 years of experience relocating to the multiple locations that can help program to select me. Second would be my communication skills, which I have been, which I have developed through my debatings and public speaking, which and they will really help me to maintain long-term relationships with the patients and also help me to cope up with the difficult patients. And my third would be my leadership and teamwork skills. That would I would really utilize my these skills to work with the program leadership to start community services and also set to start the community services. And I would like to add some more point here. I'm just not getting that. Maybe something related to the program, that inside the program, what I can do with these leadership qualities. So I'll just go to the website and try to find something that if I'm going for a leadership, if I'm going for a leadership role, then what are the available leadership role in the program, and then I'll make my answer accordingly. So I'll just talk about three things. I won't go for much, and I'll just keep everything just of one line. Like if you're talking about communication skill and public speaking, just give the a brief example that how you got those skills and how you can utilize them. Then if I'm telling about adaptability, flexibility, resilience, I'll tell how I got this experience and how it would help me in the program. And this way I would just tell about in 3 lines I'll complete my answer. And one thing more, try not to repeat the things that you have already told in your answer. So that gives a very negative impression to the interviewer that you have claimed something and that's why you are repeating the things. So try not to do that thing as well. I mean, I was also doing the same thing, and that's why I'm trying to practice it more and more, and it will come with the practice.
That's a good, insightful answer. So, from experienced person we have. Anybody else wants to answer? And if you just can switch on your cameras, that will be good for you. Like you could just ask the camera to voice as well, so you can just get opinion if you need to upgrade something on.
Dr. Suraj, special camera or special light? Do you have a different camera than your laptop and light?
No, I'm not using any different camera. Even no ring light right now. It's just laptop camera.
Do you have a MacBook or
Yes.
what laptop?
I mean, it depends on location as well. Sometimes my MacBook gives me a really very bad picture quality, and sometimes when I just change the location, then it gives a very good picture quality. So maybe you can try to sit at different places where there's ample of light, and then you can try that what will be your best location.
Okay, okay. Yeah, it's looking nice. The background is all blurred and yeah, it's clear.
Yeah, that's the option you can already use. I mean, on Zoom, there is an option, if you know about that, or I should tell you.
Please go ahead.
Yeah, so when you click on, there's an option of a stop video, and there's an arrow above that. So when you click on that arrow, there's an option blur my background.
There
So
is.
it will just blur my background.
Okay, thank you. Yes.
Okay, and one more thing, in why should we take you in your program? So as someone already told that due to my home country experience and United States clinical experience, I mean, that's a very good thing. You should talk about this, but try to sell yourself in the best way. So how it will help the program? Just tell in one line that how it will help the program. So you can just say that in a short span of with the help of my United States clinical experience and back home country experience, I can, in a very short span of time, I can become a reliable member of the team in the program. That's all. They can ultimately understand that you learn things quickly and in a very short span of time, they can rely on you. So in this way, also you can answer this question rather than telling the whole story in 3-4 lines. Just stick to one line.
Anybody else wants to go with the answer? We can just go ahead and we can shift to the next questions as well.
So, Dr. Aishman, can I
Yeah, go ahead,
start
doctor.
doing this?
Sorry.
Can I go ahead with the answer?
Yeah, go ahead.
Um, Good morning. Firstly, I think I'm adaptable and flexible since I've lived in different countries, and I think that has given me a global perspective, and that will surely help me in creating a good rapport with the team and my patients, especially since this community has a diverse population. Second, I consider myself a team player. I've been part of research projects and patient care team in my medical school, and I ensure that we always meet deadlines and avoid scheduling conflict. And this has also made me reliable and dependable on many occasions. Lastly, I am organized and detail oriented, which helps me to streamline my work and will also translate in patient interactions and having a thorough evaluation and well documented notes. I'm also a quick learner, which I'm sure and all of these qualities of mine will greatly help me during residency. And I think this is what makes me unique and why I would fit into this program. Thank you.
Okay.
Do you have
Do you want to
any
go, Dr.
questions?
Gupta? Yeah, I mean, I liked your answer, but you are very monotonous. I try to be interactive with the
Okay.
interviewer, and whenever you are giving any specific answer, like why our program, or when you are asked questions from the program director or anyone, try to call them by their name, so
Okay.
it feels very personal to them. For
Okay.
this is for everyone. I mean, I'm telling this point for everyone. I was giving a mock 2 3 days back, and I realized this mistake. Someone told me that why aren't you taking it? Why aren't you taking the name? So I just took the name initially. That thank you, Dr. Dash, for giving me this opportunity. And then throughout the interview, I did not take the name. So that interviewer told me that you are making this mistake. You have to take the name very frequently, like after every 2 3 questions you should take their name, so they should be paying attention to you. Aparna,
Okay.
I like your answer. Just try to be you can just change a bit tone while answering the question. um,
Okay.
yeah, it felt like monotonous, or maybe if you are reading it, if you have written the answer and you are just reading that, so I felt it like that. But otherwise, if
Okay.
you have written it, if it's already in your mind, then I would just say try to practice it. And when you practice it more, it will ultimately become natural. Right now, it felt monotonous to me.
Okay. Shall work on that. Thank you so much.
I just have like one small doubt, like for the general group. I also like really liked your answers, Aparna. I just wanted to ask, overall, do you think the overall answer was a little too short? Do you think like maybe it should have been longer? Like maybe Dr. Suraj can weigh in since he has had some interview experience. Do you think this is the ideal like length for the answer, or should it be longer or even shorter than this? Like I'm just kind of curious because personally I felt it was a little short. Maybe you could have talked about a few more things or like elaborated a little further. But
I was
I'm not 100% sure. I really want to know what others think.
I agree
So
with actually.
yeah, so that depends on program to program, as we discussed earlier. If you have a 30 to 40 minutes interview, then of course you can give long answers. But if you have only a 15 minutes interview, you cannot talk too much about anything, because they have at least 10 to 15 questions to ask from you. And they will most likely, they will be asking questions from your answers as well. So you have to be very specific in that case. And if you're giving long answers, I don't think so that this thing is gonna impress them. If you're specific, to the point, concise, that's the thing that they're gonna remember. Because if you're telling so many things, they will lose their interest. But
Got
if
it.
you
Thank
have
you, Dr.
Thank you so much. Oh, sorry, Dr. Sir.
any 40 minutes interview, then of course you can talk much about it. And it depends also. For example, um, if you see that interviewer is taking interest in your answer, then you can prolong your answer. Otherwise, if you feel like, even Aparna's answer was short, when you feel like even if this short answer, interviewer is losing its interest, you can just stop your answer and say thank you. So that's the key to your answers. Yeah, when even anytime you
Thank
feel like interviewer is getting bored of your answer, just try to finish that answer. That's it.
Got it. Thank you so much, Dr. Suraj. And just another quick thing. When we get our interviews, will we know beforehand how long the interview is going to be, or like will they tell you like how long the interview is going to be before you when you get the invite itself?
Yeah, they will send you the whole pamphlet of that, that who's going to take your in. Most of the program tell you that who's going to take your interview at what time, and they also tell you that how many minutes the interview would be. Either it would be 30 minutes, 40 minutes, 2 panel, 30 minutes, 3 panel, or 15 minutes, 3 panel. So everything will be told to you 2 to 3 days before they will send you the information.
Okay. Thank you so much, Dr. Suraj.
Thank you so much, Dr.
Yes,
Suraj. I
Dr.
just want to say this was going to be my basic outline, and I was going to add 2 or 3 points catered to the program. So that's why I think maybe my answer is shorter than usual.
I guess, Aparna, it was good. And even let me tell you, your answer was short here, but when you talk in the interview, you'll feel like your answer had already prolonged. So that's why people say to keep your answers short, because in the interview, when you talk, so there are a lot of things coming in your mind and you want to talk about them. And randomly, even subconsciously, you talk many things during interview when they ask you that why our program. So if you're specific to 3 things only right now, so I believe when you'll be interviewing at that time, you are going to tell more things. So don't worry about that.
Okay, sure. Thank you so much.
Dr. Khulud, yeah, just go ahead with your answer.
Yes, doctor. Thank you so much for this question. Yes, I could tell I'm an adaptable person since I have a long experience practicing medicine in my home country, Sudan, and North Africa. And I have also practiced in medicine. It was in Saudi Arabia, and currently I was working here in the US and I had experience. I work with physicians in Michigan State University. So I have this big experience, and I see myself adaptable person, and I can do it in the future residency program here. And also, I see myself I'm good leader and a good team member. And I had this skill since I was in medical school and in my practice in medicine in Sudan too. And currently also I had an experience and I am a leader in the telegeriatric fellowship program in Michigan State University, and I have a role as a team leader and a constructor, and I think this can help me more also to help residents, and I can be resident leader. Yes. Thank you. That's it.
So it was a good answer, like you mentioned about your various experiences. Yeah, then your leadership roles as well. Yeah, according to me, it was a good answer. But yeah, I think like as Dr. Suraj mentioned, you just need to specify that you need to stress on the points as well, right? Maybe 1, 2, and 3. Just keep that in your mind. Maybe you can just prepare. You can jot down your points, and you can just talk about that one after the other, and just highlight those points, like about your leadership, about your experiences. Otherwise, the points were good for me. Like,
I have a
Okay.
quick from Dr. Suraj. He mentioned 3 points. Like if they ask you what are your strengths, so does your answer overlap with the answer that you gave or no?
Yes, I mean, see whatever your strengths are, that's why the program wants to take you. So even if you are adding any of your strength here, that would be good. Or if you want to add just one strength here and one thing from the program's aim and mission, and third thing you want to talk about any unique quality that you have that you want to talk about, you can talk in this thing.
Okay, because you
Maybe
said don't repeat, so
program that I'm readily available and easily approachable to everyone. That's what my friends say, and this would be the quality that program would benefit from. That they can count me in any hard situation. So I'll be the first person that program can rely on. Maybe I can say this thing. That's the unique thing. I mean, just try to tell them some unique things that not every applicant will be telling them. So even right now, we have asked 4 or 5 applicants, and I have seen that all of us, including me, we have told them that adaptable, flexible, resilience, leadership, communication skills. So if everybody is going to say the same thing, then how would you stand out? Just I would say that when they ask you why we should choose you, you should have at least one of the unique quality that makes you different from others.
Oh, yes.
We can just jot down 6 strengths, 6 or 7 strengths, and if they ask the same, because it's unlikely they're going to ask our strengths. And the second question, like why should we take you into the program? Because indirectly they want to listen to our strengths only. So it's very unlikely in 15 minutes interview they will be asking us the both questions. But in case they ask us these 2 questions, then in one strengths we can mention 3 of them, and 3 of them like we can mention in the when they ask us the second question. And even if we repeat the strengths, that's fine, but we can quote an example with the one we didn't mention before. Because we can't just attach examples to every of our strength or every point, right? It should be 90 is to 3 is to 1 rule, right? 90-second answer, like 3 points, and we just have to explain one of them because we have to consider that we have a limited time over there.
If I mean, like, I had a, like, maybe like a solution or something that you could do in the interview. So the thing is, imagine like you write like some 10 points about yourself, like, which is like fairly easy. Again, as Dr. Suraj said, when he was listing only like, strength, resilience, adaptability, like it's a long list, right? So like Ayushman said, you could mention 3 if they ask, what are your strengths? And then later they ask, why should the program choose you? You can start the sentence off by saying, as I mentioned, these things, but also the program would benefit, or like the program would benefit from my and the next 3 points. So you're already calling back to the 3 that you already mentioned, and you're adding 3 onto it. It keeps your answer short, precise, and it doesn't make you avoid repeating yourself. Do you think that would work?
Yeah, that's what I actually wanted to say. Like, yeah, for me, I'll do that only. Like, because like it's very unlikely they're going to ask the same question in they're going to ask the same question in a single interview. But yeah, if they ask, then I would be doing that. Like I'll mention 3 of them in first one and 3 of them in that question. Or even if I repeat, but I would add an example to that. Like if I talk about my adjustability in my strengths, I can just say because I am very adjustable, but I would add an example to that. I would add my example to some other point because I don't think I'll be explaining all of them during my interview, like all the points I give. Like that's what I would do, but yeah, it's my first experience as well. So it's going to be my first experience.
If they ask you like both questions, like tell me your strength and why should we choose you? So as we discussed that we already should have 5 to 6 points already, like 5 or 6 strengths we have. So when you tell 3 strengths, then the remaining 3 you can tell in why should we choose you. Even not 3, but one of them will be from programs website, and other. I'll say try to evaluate yourself and at least write down 2 unique things about you, apart from these things like teamwork, communication, everything. Apart from them, what do you think? What is unique about you? And try to tell them that uniqueness about you and why should we choose you.
Yeah, absolutely.
Yes, thank you. Makes sense now.
Anybody else wants to give the answer to this question, then we can shift to the next one.
And you can also do one more thing, that try to find out 2 uniqueness. So one uniqueness should be in your strengths, that this is my strength and that's why I stand out. And if they ask you that why should we choose you, then you can talk about the second uniqueness, that this is something very different about me, and this can help the program in this way. You have to make a story of that. So at least you should have 2 unique things about you to discuss.
Right, absolutely.
Thank you very much for the questions. I have a question rather. For a new program, meet and greet, what are the possible questions one can ask them?
From the program leadership, or from like is the first year of the program, or it just started this year?
No, they are starting their internal medicine this year.
So you can ask them that won't be any resident, so how they have been thinking that will there be a personal mentor for every resident who will be teaching them, since there won't be any senior resident. You can ask this question that okay, and the second question they can you can ask about that where the maybe something of the program, that what future plans of the program, that what program have been thinking to bring in, as it's a new program. So you can ask that what are the things that you feel like your program is thinking to bring on in the coming years. You can ask this question as well. I mean, these two I think of right now. Other than that, maybe, and
like that's a very good question.
for the new program, if they ask you why should we choose you, and if you have good leadership qualities, then of course you can say that with my these leadership qualities, I want to work with the program leadership to set the high standards for the incoming, to set the standards for the incoming residents from next year, and we can make an example of. So in this way, you can answer for a new question if they ask you that why should we choose you.
All right. Thank you very much.
Yeah, anybody else wants to answer the question, this question? Because we have discussed this question before as well. Like, anybody wants to answer this, go ahead, then we'll shift to the second question. Or should I answer the question? Okay. So I think nobody wants to answer this question. Before shifting to the second question, before I answer my, before I give my answer to the question, just go ahead with the, just you can prepare for your second question. If you ever had, tell me when you went above and beyond to help a patient. So I can just answer the second question, but yeah, the previous one I have practiced it well, so I don't want to answer this question. Like I'll just mention my strengths over there. So I think I can answer the second question, but anybody wants to answer the first question can answer that, and then we'll show to the second question.
I'm going to answer the first question.
Okay, go ahead, Dr. Muhammad. Yeah.
Thank you, Dr. Rashman, for the question. I understand that there are many qualified applicants, and I think I'm a good option for the program because I'm bringing a diverse postgraduate experience from my homeland, which I'm be ready to bring it to the program. And the second reason, because of my research experience, I'm ready also to bring on this experience to help for the development of the medical research and the program in general. And the third reason is that because I've realized that the population here there are many Arabic speakers, and I'm fluent at Arabic. That's why I could be a good fit for the program as well. Thank you.
Anybody else wants to answer this question? Then we'll shift to the second one.
I have a request if everybody is okay with that. I would really appreciate if that's a personal opinion as well. So I would really appreciate if everyone whosoever is going to answer the question, if they would turn on the camera, so we can give them suggestions that if you are sitting in the right posture and how you have to set your camera, and if that's gonna be a setup for the interview, so we can tell you that if your setup is also good, the ring lights and your
to help that the girl through like writing the letter and all. I have used that, and I feel like being empathetic, and when we can use a skill for saving someone, we should definitely do that, because that way we are like directly saving someone's life. So that point, I think it was nothing to learn from the incident for me, but I think the question is when you have helped, the question is describe the incident where you have helped beyond your capacity. So I think that way. describe, because it was
Yeah.
not a common scenario.
Yes. Can I say something?
Go ahead, Dr.
Yeah.
Yeah.
So yeah, this kind of question, I think, from my point of view, trying to see how human are you. Not, you're not just a doctor, you feel you're treating human being, not just a disease. So I think from this kind of questions, they want to know how human are you. What did you do, how you go to an extra meal to help your patient. So I don't think this kind of something we should comment on. I learned it from that. No, they want to know how empathetic was you with your patient. What did you do which is not an area of your expertise, and you did that for your patient. This is my point of view.
Okay, perfect. Yeah. So should I go with my answer now?
Yep.
Okay, perfect. So that will be an example when somebody asks me about an interesting case, or like if they ask me like if I help, like the question we have, like if you help your patient by going out of way. So yeah, so as I can recall an incident where I helped the patient, and that was like during the COVID times, during the second wave of COVID in 2021, in May 2021, when I was working in a medicine ward. At that time, we got a patient from the emergency department. We got a patient admitted in our ward under psychiatry because she ran away from her home. Like I belong to Jammu, and she ran away from Kashmir, Srinagar, which is 200 kilometers away from my city, and she was admitted to our ward under psychiatry. But at that time, I used to interact with her every day. And then she told me about her story, and she told me that how she ran away. She had a fight with her husband, and she ran away and came here. And the police brought her to the emergency, and from there she was admitted to the hospital. And I used to interact with her daily, and daily she used to request me that please do anything, but I want to I just want to go back to my family, to my husband. So I just brought up that issue. I brought up that issue with the higher authorities as well. But yeah, since it was COVID and a lot of things were going on, so at that time nobody was able to help her out. But then using a social media platform, I tried to search for her contact, to search for her head of her village, and head of her village and other contacts in her village, and I messaged them multiple times, and that's how I got a chance to get her reconciled with her family. So yeah, that is one of the incidents where and currently I'm in touch with her, and she knows that I'm on this journey, and I'm on this journey to get a residency in the United States. So yeah, that is one of my incidents where I went out of my capacity to help a patient. I know that I didn't speak very well, but yeah, I have to just frame it. But yeah, that's what my example is.
But I think the example is very good, and this is something which is not related to medicine. So definitely, it's beyond your medicine, but and also you have helped someone during the crisis time. So I think the message you are trying to deliver is really good. So the example is good.
The example I just have to phrase and practice well.
Yeah. Yes.
Yeah. Anybody else wants to answer the question? Like Dr. Suraj, do you have, or Dr. Om, do you have any example you can just come up with?
Yes, so I have framed it like that. I vividly remember during the COVID time, I had a patient admitted in the ICU, and at that time, the family was not allowed to enter the hospital premises. While talking to the patient for the first time, I remember his concerns and fears that he wanted to be with his family and he did not want to lose them. With our team, we thought about a plan that how can we connect the patient with his family members, and we tried to decorate the patient's room with the family photos so that patient can feel it like a home. And before finishing my shift, I regularly used to make a video call to the patient's family so they can talk to the patient and they can be reassured. And if the family has any questions about the progress of the patient's health. And I also reassured the patient that this was everything. And apart from that, yeah, in this way, I went an extra mile. In this way, I went an extra mile, clearing patients' concerns and also reassuring the family that the patient was in good hands. I believe this was the thing that the patient was able to speedily recover from the COVID, and within a week he was able to discharge. So this was the, I mean, I'll still frame it in a more better way, but this will be my memorable patient, and when a time when I went above and beyond. So still I'll frame it much better.
Yeah, that's a very very good example. Like it shows a very good side of you. Like you're very empathetic and how concerned you are for the patients. Yeah, so like that, if even if somebody doesn't have example, like if you must have, like you can just frame it in a way that maybe during COVID times when you were working in wards or ICU and they were not allowed to, your patient was not allowed to meet the family, and that time you used to just do the video calls and let the patients see their family, and both of them were reassured, and even that even helped them to get recovered soon. So that's a very very good example. Like, yeah. So anybody else wants to just answer this question?
I just have one small doubt before, like, I need to like frame my answer. Like before that, the thing is, my example is something I've already like talked about in my personal statement. Do you think like that would be fine for me to like mention it again? Because like I did talk about like this one instance. Does anyone have any
Yeah, if you have talked about if you have already talked about this patient in the same context, whatever the question is, you can talk
Yeah.
about that.
Oh, I can? Okay, that's awesome. Okay,
If you
then
have
can you give me like
already
10 minutes? I'll frame my answer.
There's
Oh,
no
sorry,
Yeah,
Dr. Suraj.
if you have written it in the personal statement in the same context, whatever the question is, then of course you can write it.
Okay, awesome. Thank you so much. I'll just take a few minutes. I'll frame it and then I'll get back to you.
Anybody else wants to answer that question? Like, yeah, go ahead, Dr. Mohammed.
Yes, I would like to answer, but just give me a second to turn on my camera because I would like your comment about my camera setting as well. So, okay. All right. Yes, so it was it was a young girl during my internal medicine duties. So she presented to the ER with acetaminophen intoxication. So after we did the emergency treatment for her by giving her the N-acetylcysteine, and we follow up blood test, and we made sure that she's all right, I communicated with her and asked her about the reason why did she overdosed in the acetaminophen. And she was open to talk. She told me that she broke up with her boyfriend. So I reminded her the importance of being detached from everyone, and our lives is the most important thing. We should try to, we should try to not to lose ourselves because of anyone else. So yes, after the counseling, I also offered some psychiatric consultation. I reached out to my one of the attendings who was my friend at that time. I told him about the patient, and he accepted her. He also counseled her, and few weeks later, I received a call from her that she is doing well in her studies and she feel way better. From that time, I remember I always remember the importance of treating the patient as a whole, not as a disease, and the importance of good communication and taking care of our patient. Thank you.
That's a very very good example.
What about the camera setting, you guys?
Your camera setting is like I'll just take Dr. Suraj as a example, like how I should like look into the camera so that they can see at least my hand movements as well. So your camera setting is just like me, right? I just have to turn my table and just make some space. But yeah, I will just try to be like what Dr. Suraj is right now, because even that's how I feel that it should be like. They should even be able to see my hand moments as well during the interview. That makes it more interactive.
Ayushman, are you going to keep your camera at this level in the interview as well?
Sorry?
Are you going to close to your screen during the interview as well? Dr. Mohammed, I'll come back to you. Just give me 1 minute. Are you gonna the distance? I mean, are you gonna be at the same level during the interview as well? Right now you are, because I feel
you
on the
asking
whole screen I can just see your face, nothing else.
yeah, no, because there's a wall behind me, so I have to just turn my table, which I'll be doing like today or tomorrow. I just turn it, and I just have some distance. No, my upper half of the body will be visible, like not like you, like yeah, like you. I'll try to be visible in front of the camera.
Okay, so Dr. Mohammed, so for you, your eye contact was good, but again the same thing. Your camera should be a little bit further from you.
Thank you.
That you only need that thing, because I cannot see your hands, no any hands. So that should be visible, and you can just keep your laptop a little bit far away.
Okay.
Yeah.
I'll do that. Thank you.
No problem.
Anybody else wants to answer this question?
Yes, me.
Go ahead, Dr. Raghuram. Yeah. Dr.
Okay. In one instance during my work in the GI bleeding center, I encountered a patient who has scheduled to undergo endoscopy due to GI bleeding. The patient was visibly distressed and expressed concern about the procedure and its complication. I understand that he needs emotional. There's I understand by understanding the emotional impact of undergoing an endoscopy, I decided to go above and beyond to provide additional support. I spent extra time with the patient, addressing their concern and answering their question in detail. I explained the entire endoscopy process, including how it is a minimally invasive procedure that that can need like direct visualization of the GI tract to identify and treat the source of bleeding. And I reassured the patient that the medical team was highly experienced in performing the endoscopy, and I emphasized the safety and effectiveness of the procedure. I also arranged for the patient to have a pre-endoscopy consultation with the gastroenterologist who would be performing the procedure. And during the consultation, the patient had the opportunity to discuss their concern and receive personalized information about what to expect. And in addition to address the patient medical need, I provide him with emotional support by acknowledging their anxiety and offering relaxation technique to help manage their stress leading up to the endoscopy. Mm-hmm. What's your comment?
It's a very good example. It's like an example similar to Dr. Mohammed mentioned, which again shows your that which again shows that you need to talk to the patients beyond just treating their disease. So that's again a very good example for sure. But yeah, you need to just concise it depending upon whatever is the duration of your interview. Otherwise, it's a good example.
Thank you.
So yeah, anybody else? Dr. Om, are you ready with your example?
Not really. Like I don't think I'd be like. I think I need some more time to like frame it properly. But yeah, if others, sorry.
Even if you're going to be spontaneous, you'll come up with a good answer. Just go ahead with that.
Okay, let me try. Right. So first off, I'm sorry for like not like turning on my camera. The thing is like I have it like I'm actually like attending this meeting through my phone. I'm just kind of moving about in my house. So yeah. Secondly, when during my final days of my internship rotation in my medical school, I volunteered to work as a casualty medical officer because we were understaffed due to some scheduling complications because of the COVID-19 pandemic. So during that during my time as the casualty medical officer, we had a patient come in, an 18-year-old girl who had ingested rat poison. And she came to us in a very debilitated state, and through examination and blood testing, we found out that it was very unlikely that she was going to survive. She was going to uh, like basically like we thought that she wasn't going to last through the night. Again, I'll reword this, but so when we because they were like usually like the internal medicine resident or the attending internal medicine physician on call breaks the news to the patient, but since we were short staffed and I was fluent in the local language, they tasked me with like breaking the news to the family. So when I went, I explained to them that their daughter's prognosis. When I went and I told them, they were completely heartbroken, and they just kept asking me what could be done. Is there anything that I could do? So I chose to stay back 4 hours after my shift, 4 to 5 hours after my shift had ended, to stay back and to work with that family, process their grief, answer any questions they had, and to work with like neighboring hospitals to see if anyone had any ICU beds available, because our hospital did not. And so I stayed back well past my like working hours to console them and work with them and like work for them to see what best could be done for their daughter. So that is basically the gist of my example. Again, I will phrase this much better. This is just a content, like this is what I wanted to talk about, but yeah, this is what I want to mention. Anyone has any thoughts?
Hi, Om. So I believe your answer is too long. That's why I just lost my interest. I'm sorry, but yeah.
No worries, doctor. Please let me know. Anything else?
No, I mean, just keep it short and for 1 minute only.
Mhm.
That's
Yeah,
the max.
absolutely.
For short interviews, for any short interviews which are of 15 to 20 minutes, all your answers should be within a minute. Except tell me about yourself, that you can push for 90 seconds max.
Mhm.
8 seconds. Otherwise, your answers should be in a minute. Because
Okay.
after 30 seconds, it's a human nature that after 30 seconds, you lose your interest. If there's anything interesting that you're telling, or if you're telling it in an interesting manner, so that might catch their attention.
I see.
But they were I'm really sorry. I don't want to offend you.
No, please. We're here for like honest feedback, right? Even if it's like, if it's something like negative and like something I need to correct. No, I absolutely understand that my answer. Again, I was just saying this as this is what I wanted to talk about. Like I said, I needed much more time to like frame my answer. Like you said, to keep it interesting, short, and to the point. I will definitely like frame it in a better way. I get that.
I started writing about that, so that's why I because
I get that. Thank you so much, Dr. Suraj. No, that's fine. Like this is the kind of like advice I think we all need, right? So yeah, thank you so much. Yes, I will work towards keep making it much shorter and like to the point and like much more clear.
In the camera, that also actually keeps your interest when you're opening the camera. Even then, you're telling a long story. Sometimes it helps the interviewer to keep their interest. When the camera, I mean, of course, during the real interview, the camera is going to be on for everyone.
Yeah.
The session as well. So when your video is on, so everyone will take more interest and listen to you more properly rather than on audio call.
I understand. I think from next meeting onwards, I'll attend the meetings from my laptop and like I'll turn the video camera on so that at least even if the setup is not correct, like at least my face will be there and like, yeah. Thank you so much, Dr. Suraj. Oh, sorry. Please.
Interactive session more better way. At least it will help some of us.
I completely understand. Yeah, I'll try to like fix that from tomorrow.
So
And thank you so much.
I just want to tell something, like I just want to have your opinion. Like it depends, like the length of the answers. It depends. Like we can just, like if we know the interview is for 15 minutes and we just see that within 10 minutes, like they have asked us 7 to 8 questions. So that means that we are, giving, maybe we are giving short answers, or we are talking very fast. So at that time, don't you think we need to slow down and try to make our answers more long, so that at least we can just cover the remaining 3 or 4 minutes just answering, and maybe last minute we can ask the questions to whoever is interviewing us.
The thing is that you are the driver of your own interview.
Mhm.
If you have told anything interesting and tell me about yourself, he might take the whole interview on that, and then you can talk about half an hour on those things.
Right.
And if he does not take interest in telling me about yourself, if he has on his thought that he want to talk those written questions, then you have to give your answers accordingly. If you think that interview is going in your way, like you wanted to go, then you can of course talk about everything, like more than 1 minute as well, because he's taking interest in that thing. That's why he's giving you the chance to talk about it more and more. But if he's not giving you chance to talk about that thing, then I would say just keep it short for 1 minute and go to the next question, so that he can assist you more and more about your personality.
Mhm. Right. Yeah. So anybody else wants to answer this question, because we are like we are 1 or 2 hours. Okay, just go ahead with your answer. Anyone?
I have a different scenario if no one else is talking.
Go ahead. Go ahead. Go ahead. Yeah.
Okay. Of course, this happened recently while I was working in ICNA Clinic Dallas. It is actually a non-profit clinic or organizations where we are able to provide healthcare services to the refugees and asylees. And I met like a 55 years old man who is having like multiple comorbidities like diabetic and hypertensive, and have like also coronary artery disease. And the patient came and told me that he is out of his refill for almost the last 3 months, and he is currently unemployed, and he's not able to get his refill. And I felt actually so much feeling for him, how he's staying 3 months while he's high risk patient without medications. And he even mentioned while he's talking, even that he suffered to get into our clinic because he don't have money, and he is like don't have an income. I approached my medical director and I spoke to him about the patient, and we of course provide him with his referral, and we also arrange some Uber transportation to his place. And the patient also, after all this waiting time, I offer him some of the food which was for us as a volunteer there. From this, actually, I felt like working in ICNA Clinic Dallas is so much self-gratifying and double rewarding place to work, because you are able to help such populations, which I wanted to continue it actually in my career.
That's a very good example, Dr. Shaima. But one thing that I just want to say, like, it's a very, very good example. But when you say, like, instead of saying that you help that patient, but when you say that I asked to help, just to help that patient, I asked and I tried to raise funds from my friends and family. And using that fund, I was able to, well, that would like sound more good to me. But yeah, that's just, otherwise, it's a very, very good example. Yeah.
Yes, it's a good addition. It's a good addition to can fund and help these organizations also financially. Yes, thank you.
You could just ask, like I think it will sound more good to me, but I am an inexperienced person, so like I don't have any experience of anything. But yeah, if somebody says that they try to raise the fund, asking help from family and friends, you told them, you just told them about the situation, asked for any kind of help, and that way you were able to raise some money, and with that you were able to help that patient.
Yes.
So that might sound good. Otherwise, it's a good example.
Yes, much better. Yeah.
Like experience, like back home country, we remember that we used to in US the different system is different, but back home country, I remember when we were doing internship, and we used to have staff, and very limited staff was there, and the nursing staff especially, they used to come very late, or sometimes they used to make off. So you can even mention about that while you were working in internship, and it was not a first time, but you remember there were many times when you went above and beyond for the patients, because there was a shortage of nursing staff. So to provide dosing on that, to provide patients with the timely doses, uh, you used to give them the doses on the time if the nursing staff was short, or if they were not on time. I mean, just don't frame it as a negative way that the staff was not coming. You can say that you can just remember, frame it in any emergency or anything, that the staff did not come, and then you perform that duty so that the patient does not miss their dose. And you can say that that's even in back home country, it's common that doctors can sometimes, instead of nurses or staff, you also give the dosing to the patients. Here it's not allowed for doctors to give the dosing, but back home country, it's we usually do that whenever there is no nurses or anything. So any kind of story you can make from that as well.
Even like,
And
yeah,
usual question is not about the real stories. You have to make your own stories, and you have to frame them. You have to practice them very well that they feel real.
Right. And like one more example I have is, I'll just tell in a brief. Like during the COVID times, we used to have WhatsApp groups where we used to generate SOS calls on internet, on Twitter, through which we used to arrange the oxygen cylinders for the patients who didn't get who just needed them desperately. We used to just raise SOS calls for them from the Twitter, and that's how we used to help patients as well. Plus, we used to even call for help for the food as well. Like there were many for underprivileged, as during COVID times, the it was difficult. Like many people used to go to bed without food. So that's how we even used to raise calls and funds for the food, plus even the oxygen cylinders as well. So you can even frame that like you went above and beyond to help the patients during COVID.
Or frame, I just got an idea that you can frame that your hospitals, wherever you were working, so your hospital setup was like that. In the morning time, the nursing staff used to be available every time since 2 o'clock. After 2 o'clock, in the evening shift, only at the dosing time, staff was available. Rest of the time, a doctor has to take care of the whole ward. One day I remember there was a strike in the evening, and the nursing staff, nursing staff which had to come in the evening shift, they could not reach on the time, and patients were scheduled for their evening doses. And you remember at that time you took an extra miles to dose the patients timely so that they don't miss their dose or something like that. You can frame it like that. In this way, you are not portraying the nurses as in a negative term that they used to make off, or there was a shortage. You are not portraying those things. You are just saying that there was a strike one day, and the nurses could not reach on time in the evening shift, and you are the only person in the whole ward. So you just gave the timely doses to all the patients so that they don't miss their doses. Any suggestions for that? I mean, if this seems to be a better answer.
Yeah, this is actually a really good example. I think, like, again, staying back and like trying to like take some of the burden in situations where there's like either a shortage, because like I think a lot of people can talk about during the COVID pandemic, right? Because there is a lot of shortage, and yeah.
And even like you can just frame it in a way when I was working in a rural setting, and over there, like the people do experience shortage of staff as well, right? But yeah, we can't say like in hospital we have the shortage of staff. So instead, like if you can use, like sometimes people work in rural setting during their internship and stuff. So at that time you can frame this answer very well. It's a very, very good example. And it just shows a zest to you're just zest to work and help the patient in the best way possible.
Exactly.
That's
even if you want to make it that all the other staff was busy in the different wards or different floors, and your floor's nurse staff was stuck in the traffic, or she was stuck in a strike, something like that, and you did not know what patient needed the orders, or you did not know how to give the doses. So you took an initiative. You went an extra mile and video called that nurse that to explain you that how you should go ahead with this situation, and she explained you that how you can give the doses to the patients, in what way, and where are the things kept. She explained you everything, that all the things you can find in this drawer, or here you can find all the doses for the patients, and then you can go ahead and you started dosing the patient timely.
Like, yeah, that's a very, very good example, Dr. Suraj. But I think, like, just to have a concise answer, we can just say at one point of time the staff wasn't available because of some emergency at home. So now, since I was the only person in the ward, so I had to give the dose to the patient. And I just called the nurse. I had a word with him, and she explained me everything. And that's how I gave doses to all the patients in that ward on my own. Though it was not, it was a duty of the nurse nurse who was on duty, but because of an emergency, she was not available, and we had to give the doses to the patient. And I think that would be more concise answer. And but the example is very, very good.
Yeah.
And that's like you just even mentioned about an additional skill that we have as well. Like, we can give the doses to the patient, though it's not a over here, but yeah.
Yeah, you can just don't include the doses. You can also include the blood work, which was required like every 4 hours. Sometimes patients are required every 6 hours, or every 8 hours they require. So you can also include that thing as well.
Right. Absolutely. Yeah, that's a very, very good example. Anybody else has to say something, like then we'll close the meeting. And we can just take two or three questions for tomorrow. Like one interesting question that somebody asked me during like one of the mocks I did with my friend, and he asked me like what you can relate to in your kitchen. Tell me an element you can relate to in your kitchen.
I have two interesting questions.
Yeah.
Asked recently during a mock. So one of the interviewer asked me that teach me anything in 1 minute.
Okay.
Okay, so let's start answering on this. He just bluntly asked me, what can you teach me in 1 minute?
Okay.
I can educate the patient.
Someone telling the answer for this. I'm sorry. Like somebody teaching pranayam technique. Like one of my friends got this in the interview, so she just taught him some breathing technique and came out.
Yeah. I can teach my patient for the use of the inhaler because I did asthma and allergy rotation.
Yeah. Okay. I mean, it's not necessary that it should be medical related. Tell me anything. As he wanted to actually, when I asked after the interview, he told me that I just wanted to check that what things have been going on in your mind, and apart from medicine, what are you as a person? So he just wanted to test that. So bluntly, I said I can teach you making shrimps kadai. Shrimps curry I can teach you. So he said, okay, teach me that in 1 minute. So I bluntly told everything. How can you make shrimp curry in 1 minute? So he was expecting such kind of answer, and so I'm also expecting such kind of answer. Teach me anything in 1 minute. Any medical thing.
So I was just going to say.
Yeah, so just we can take this interesting question. Yeah, just one by one, everybody can answer. Like, just take 1 minute to answer. So yeah, we'll go with Dr. Muhammad right now, Dr. Ali. Then we'll just go to everyone one by one. Go ahead.
Thank you for the opportunity. I think one of the things that I can teach in 1 minute is saying good morning in my tribal language, which is called the Fulani language. So the words are Jamwali. So what we say in the morning, how we greet each other in the morning is Jamwali. So if we can do these words together, then we can phrase them together. And I will ask to repeat the first word, Jam, and then repeat the second word, Wali, which both of them translate into, I hope you spend a peaceful night. Yeah, that's it.
A good idea. Yeah.
Question.
Yeah.
I think many of us they speak other languages. I think we can use this in our advantage in this question.
Yes. It's a great idea.
Can you just repeat your example again? Like I couldn't hear you. I'm sorry.
My example is, I would say that I can teach the program director how to say good morning in my tribal language, which is Jamwali. We say Jamwali, which is like good morning. And the meaning is, I hope you spent a peaceful night. That's the translation of the phrase. What I would say is that I would ask the program director or the interviewer to repeat the first word first, Jam, and then repeat the second word, and then we can say the whole phrase together, which is Jamwali.
So I can even teach somebody like to say namaste in from my language.
Yeah.
That's
Good idea.
Like I can
Okay,
teach.
excuse me. I have an interesting question. I felt kind of difficult to answer, and I want to take your opinion here.
We can take, Dr.
When
Sorry to interrupt. We can just take that tomorrow. Like right now, we can just take this and we can take that tomorrow. You can post in the group and we'll take that. Will be the first question we can take.
Okay.
Right,
Okay.
and once Dr. Burhana told, like, I think it's the best in the world, like best in the bad experience doing a medical school. That will be another question. But yeah, we'll just finish with this question. We can get some ideas from the answers, and yeah, we'll take the next question tomorrow. You can just post in the chat, and I'll post in the group.
Yes, sure.
I'm so
Thank
sorry. I just finished this question, and then I'll take next question tomorrow. Right. Anybody has the answers or more answers to this question? Like what you can teach me in 1 minute?
I will say, like, I can teach you the cooking of Maggie, which is a kind of very famous Indian dish, the kind of a noodle that is very, that especially the children used to fond of that. So I can teach you that recipe in 1 minute.
Yeah, you can even say that it's like commonly sold because their sole motto is that you can cook it in 1 minute. So that's why I can teach you in 1 minute.
Yeah, that's a very, very good example, of course. Yeah. Okay, Dr. Shah, you want to go with your answer? Just go ahead.
Yeah. Can I say something else, like maybe to teach you or teach the program director how to deal with stress, let's say. So I will give a stress management, like in 1 minute, how to take the mechanism of, let's say, inspire, exhale, and like the strategies of dealing with the stress. So that would be some mechanism that I will offer, and I don't know if this is a smart answer or I have to prepare for something else.
That's a good find. Like, yeah, you can just teach somebody a relaxation technique within 1 minute, and it will help them to relax. Like, it's a good answer. Like, the answer is subjective, right? No answer is perfect for 1 minute, right? That's even a good answer. Like somebody is telling that told she can teach how to cook Maggie. Like Dr. Suraj told something else. Like he can teach like how to make shrimp kadhai, right? And then Dr. Ali had a good answer as well. So it is a subjective thing. You can tell that I'll tell them these many times to inhale, then exhale, this and that, and that will that will help that person to relax during that time. So that's a good answer.
Okay.
The only thing I would mention is that this is one of those questions that like can show the interviewer how interesting you are, right? Like it can make the program director really interested in you, like just beyond like your medical career and like what you've done there. So I would really like work on this question, like because if it's asked, I think it's a really it's a good opportunity to impress the program director. So again, like what any topic is fine, like even the how to handle stress, I think that's a really good topic. But again, work and frame that answer in such a way that the program director is interested, they listen and they come away with like a very good impression of you.
Maybe you can also what we say yeah, if somebody has if somebody is interested in paper arts, they can tell that thing. I mean, you show them that you know the paper art and you can teach them paper art in 1 minute. Like we used to make paper aeroplane in childhood. So you can teach them making that as well. It's also interesting thing. And apart from that, what else you can say?
Something, oh sorry, if I may, like something that's actually like pretty cool, that like if you do know how to do it, it's kind of like this thing teachable in like a minute, is how to whistle. Like I think that's kind of interesting. And yeah, it's a very simple technique. If you know how to do it, you can teach someone how to do it in a minute. The basics are very simple.
Yeah. So
I
that
can teach you how to make a chicken biryani. Like I can just teach you how to make a chicken biryani in 30 seconds. So that would be
no, no,
weird.
no. I have one more great idea, and that would look very cool. That would show the diversity in different languages. You can tell him that I can teach you how to say hello in different languages. You can choose 5 languages, and then like in French, Spanish, Urdu, Hindi, Sindhi, Arabic. So you can any of your languages you can choose off, and I guess 5 would be fine, so that he can learn that in 1 minute.
So we can just, we can just go with one. Like in Hindi, we say hello, we address as namaste, right? And like in Urdu, like what do you address?
In Urdu, assalamu alaikum.
Assalamu alaikum. Okay, perfect. In the like in Sikhism, we just say Sat Sri Akal, right? I think in French we say bonjour.
Yes. So I mean, this is this is interesting, I guess.
Yeah.
So that shows your diversity as well to the program director.
Right. Yeah. Exactly. Like even if we just teach them the 4 words or even 3 words in 3 different languages, right? That would be good. Like Maggie example for me works. And yeah, as Dr. Ali is even mentioned that we can teach them how to say namaste or something in our own language for 3 to 4 languages. That's a very interesting answer. Yeah. So anybody has other answer to add to this question? Just go ahead. Like what you can teach us in 1 minute. Just come up with the you have in your mind.
This was also kind of something that I want to. Sorry, please go ahead.
I just want to say, like, you can talk about if you're from India, you can talk about parathas because it's something they know about, like Indian parathas. So you can just say, I can make you teach like normal, just simple parathas in 1 minute if you're like a foodie.
I can just even talk about how to knead a dough, like how can they make dough out of flour. I can even teach them in 1 minute.
Yeah, I think I will talk about how to teach everyone love fried chicken. I teach you how to do a very good fried chicken in 1 minute.
Okay, perfect. Should I give my recipe of chicken biryani in 1 minute? I'll even take less than 30 seconds to give my recipe.
No, don't do that because biryani is not possible in 1 minute.
No, I can teach somebody how to make a biryani. I make it in a very easy way, right? I can just.
Can you send the recipe in the chat, please?
Because I'm just waiting for Wednesday to eat non-veg because tomorrow is Tuesday and the Ratras are ending today. So I can teach somebody how to make chicken biryani in 1 minute. But I would go with some other example because that's too much. Anybody else wants to answer to this question?
Maybe you can see if the program director has not tied the tie note very well, then you can teach him that.
Sorry?
Tie note, teaching someone a tie note, that's a very difficult thing.
Yeah, we can teach somebody how to tie laces or, how to, yeah, we can teach about the tie knot as well. But for that, I should know how to tie a knot. Yeah. So,
but maybe it will look much better if you see that program director's tie knot is not very well, like it should be in triangle shape, and then you can explain him that in this way you can make a better tie knot, and he should remember you for that. It's not offensive even.
Okay, I'll just like we are about to end, so somebody just request. I can give my chicken biryani recipe in just like 30 seconds. Should I go ahead with that and then we end the meeting?
Yeah, sure. Go ahead.
Okay, perfect.
I'll make it today. Like right now, I still have to make lunch.
Okay, you're in US, right? So I can just give a recipe, take a bowl, add some chicken pieces to it, add 2 spoons of curd, and add some spices. One is the green cardamom, black cardamom, and then the cloves. Then add some salt, some red chili powder, and yellow yellow chili powder as well. There's something is called that we call as haldi in our language. Then mix it well, keep it on a side. Then take a pan, add some oil to it, and then add that marinated stuff into that pan and allow it to cook for 10 minutes. Then after that, add a second layer of partially cooked rice, like cooked rice. You can take cooked rice, boiled rice, add to it, be another layer, and to top of that, just add some fried onions and some kesar in water. Just add it, and you can just add some kevra sense and let it cover it with a lid and let it cook for 10 minutes. Yeah, so that's how you can make biryani. But I won't talk about it during the interview.
I
That's
meant that haldi wala part you can take like turmeric. That was turmeric.
Yeah,
Not your
turmeric.
recipe.
Yeah, I was
not
just going to mention that.
turmeric. Yeah, we can add some turmeric. So that was my recipe, but I won't talk about it. I was just joking. I'm kidding. I'll just come up with a better example. Sorry.
Go with the languages. I'll go with the languages part, teaching them how to
I can't teach somebody how to make biryani in 1 minute, right? That's too weird. I was just kidding.
I'm curious. Are you guys going to teach them how to do something, or just like teach them about something, like talking about it? Like, because like if it's talking about something, then like, again, there's something from like my personal statement, like I mentioned at the start, that I kind of wanted to talk about, that I can explain to them, because it is kind of confusing.
I can say like if the director is a lady, I can say like I can teach you how to wear Indian sari in 1 minute.
Yeah, that's again a good thing. Yeah.
Oh, that's really good.
See, this question is, there's no right or wrong answer to this question. Every program director would have their own opinion. Some program directors they want to listen any funny answer. Some they would might to listen to a thoughtful answer. And somebody who loves cooking, he might wants to know about the cooking question. So that depends. So I guess you should have a neutral answer, and that should fit everything. I mean, it should not go in negative or it should not go in positive as well. So just a neutral.
Instead of at that time, like instead of not giving an answer, you should come up with anything. Like everything is interesting, right? You don't know, like the other person has the knowledge about it. Like even if I start telling them the recipe of chicken biryani, if the other person doesn't know what a chicken biryani is, that will be interesting thing for them, right? And like if you talk about the languages, I can teach them the languages in 5 different. I can teach them, how to greet somebody in 5 different languages. That might be interesting for the other person, right? They just want to know presence of mind, and that's it.
You can even most of the persons here, they do not know about cricket, so you can tell them that how to play cricket.
Right, absolutely.
That's a basic rule and how it works. That's it.
I have like 2 questions I just wanted to ask. First question, again, like there was something in my personal statement that like it was in my like first paragraph about something related to gaming, that like it's kind of confusing, that like maybe I think I could like talk about it and explain it to this thing. Do you think that would work? Because it's again something from my personal statement.
Yes, and if that is something unique, the interviewer might ask directly. He would not give you a chance but he would ask you directly that, okay, I have seen a personal statement you have written about this game. So can you please tell me more about it? Then there you can take the lead. Okay, I can teach you this game.
Okay, awesome. Thank you so much. And the second question I wanted to ask is, do you think it'd be okay to start off by asking the program, whoever asked this question, whether they want to learn, like instead of like saying like I can teach you how to make chicken biryani, for example, this thing I can talk about like I can teach you how to make chicken biryani. Is that something that you would like to learn? Like, do you think asking that question to make sure that it's something that they actually like want to learn, instead of us just starting?
I don't think so. I mean, you are saying that when that question is being asked or randomly?
Yeah, when that question is being asked. Like if someone asks, teach me something in 1 minute, I would respond like, I can teach you how to make chicken biryani in 1 minute. Is that something that you would like to learn? Like that would be my first statement. Do you think that would work?
I don't think so, because he has given you an open question, and then you are leading that question again to him. So it would be better that if you just come up with something that you directly, and it should be your choice, what you want to teach him.
I see. Got it. Thank you so much, Dr. Suraj.
I feel during the interview, this question would, like we are discussing this question. Dr. Suraj talked about this question, but maybe many people, like, this question would be very random for them, right? So at that time, you just have to come up with the answer. Like when I was having a mock interview with my friend yesterday, I think I was having it, and he just immediately, he out of nowhere he asked me like what element in a periodic table you can relate to, and then second question he asked me what element in a kitchen you can relate to, right? So at that time, I think we just come up with spontaneous answers. When he asked me about the element in the kitchen, I talked about a box of spices. I can relate to that because it adds flavor to the food. So I think like wherever I go, I try to lighten the mood, and like so that is why I can relate and I can just add to the mood around. So that's why I relate to this. But when he asked me what element in a periodic table you can relate to, I didn't have an answer to that, right? But then when he discussed me, he told me that you can tell that you relate to oxygen or you relate to some of the inert gases, right? Maybe so, and you can just explain maybe in one or two lines why you relate to that inert gases, because they don't react in a situation, right? So you just try to try to remain calm in a situation thing like this. So yeah, so it depends upon the situation. Like any weird question they can ask during the interview, but you need to have some answer. They just want to see your presence of mind.
Okay. Thank you so much, Ayushman. I'll keep that in mind.
Okay, so we'll just take like one question. Dr. Shaima just told in the chat, have in different languages. People teach them to say love. Yeah. So somebody even told, Dr. Nivedya wrote that we can teach them I love you in different languages. So yeah, that's even something interesting. But yeah, I even need to learn how can you say that in different languages?
If they ask me this question, teach me I love you in different languages, I'll start singing that song, Hindi song. अंग्रेजी में कहते हैं क्या?
Yeah. Okay, perfect. Okay, the Dr. Sharma talked about the question. Tell me when your integrity was challenged. We'll take that question tomorrow. And one more question, like what was the best and the bad times in your medical school?
There was one more you can add on for tomorrow that tell me a time when you failed in a team or in a team, when you failed as a leader or when you failed in a team.
Okay.
Yeah, this was asked from me in a mock interview. So if you people want to discuss that.
Right. Okay, we'll discuss that. No problem. We'll just take up these 3 questions tomorrow. I'll just post in the group, right? And we can take up these 3 questions for tomorrow. Yeah. So I just end the meet and thank you so much everybody for joining. We had some interesting questions and tomorrow we'll meet at the same time. Thank you so much. Have a good day, night ahead, depending on your time zones. And see you tomorrow.
Thank you.
Bye.
Thank you.